In the spring of 2020, Massachusetts experienced a surge of COVID-19 cases. But not all communities were affected equally.
Very early on in the pandemic, we saw that 40% of our patients were Latino and Spanish speaking. So when we began to see those incredible language needs, we just basically put out a call to action. We tried to identify through our multilingual registry all native Spanish speaking doctors who were willing to help our surge team stand shoulder to shoulder with them.
The result was the Spanish Language Care Group, 50 native Spanish-speaking doctors from 15 countries and 15 distinct disciplines, who worked for 6 weeks at Mass General Hospital to bring clinical, cultural, and linguistic competence to the care of patients being treated for COVID-19.
I was one of the first residents to join the Spanish Care Group. My biggest shock was going to the floor, and I saw all the names written on the glass door: Rodriguez, Gonzalez, Mendoza, Martinez. And the more I walked through, I just recognized that this was something that was devastating my community.
Being hospitalized with COVID was a very isolating experience. People are masked, you're not seeing your family. A group of caregivers walks in full, PPE. And what we were able to do with the Spanish Language Care Group is walk in as part of that team and say, "Hola señora, aquí estamos para servirle. Yo me llamo el doctor Betancourt, aquí estamos. ¿Cómo se siente?"
Buenas tardes, señor González. ¿Cómo está?
Muy bien, muchas gracias.
Mi nombre es Natalie. Yo soy una de las doctoras que está con el equipo cuidando de usted, ¿ok?
Okay, mucho gusto de
Mucho
conocerla.
gusto.
And in that moment, just those simple words gave the patient a sense of comfort, a sense of care, a sense of relief, that they would be understood.
Vamos a tener que de pronto intervenir y quería hablar con usted acerca de cuáles son las mejores opciones.
I had emotional conversations. I shed many tears with patients' families.
Señora González, buenas tardes. ¿Cómo está? Mi nombre es la doctora Green. Yo soy una de las doctoras en MGH. Estoy cuidando a su esposo.
I just felt that it was so important for them to know that there was somebody in the room that cared for them. For me, physical touch is so important, and I think maybe it's very cultural. And so many times I would hold their hand. Families would tell me, tell them I'm sending them a kiss, or hold their hand, tell them I love them. And so I did. Every time that I have the opportunity to communicate with a patient in our language and that I can tell that it has made a difference and improved their care, it constantly reminds me of why I chose this field.
The members of the Spanish Language Care Group, and myself included, have all said to a person that this has been one of the single most gratifying experiences of their entire career, and really will reflect on it for the rest of our lives.